Thank you, Laura. So good morning, everybody. My name's Bob Fryatt. I'm the Project Director for the Health, Finance and Governance Project. We have some fun things for you to do over the next few hours, and I want to give some personal highlights from the HFG project, some of them which are similar to Kelly's. But before I do that, we'd like to just remind you some of the things that have been happening since the project was launched in 2012.
Oppan Gangnam Style.
Oh my God, we're doing another story on this? Gangnam Style.
Joseph Kony.
Viral on social media sites.
Former South African president and Nobel Peace Prize laureate died at the age of 95. Typhoon Haiyan wipes out entire towns in the Philippines.
The outbreak in West Africa was first reported in March and rapidly became the deadliest occurrence of the disease since its discovery in 1976.
A fifth year of insurgency, and the bloodshed is getting worse.
Elections in Egypt, South Africa, Mozambique, Tunisia, as well as Namibia, and they all have something in common. They were well organized, declared free and fair, and their results generally accepted.
A 7.8 magnitude earthquake centered in Nepal.
The death toll now surging.
The endorsement by all the member states of the United Nations of the Agenda 2030 and the Sustainable Development Goals
is like the last missing piece to complete the architecture of the 2030 Sustainable Development Agenda.
Universal health coverage is a powerful social equalizer, a route to greater social stability and security.
The level of alarm is extremely high.
The World Health Organization said it's pulling together an emergency response committee, saying the Zika virus is, quote, spreading explosively.
Areas of Thailand's capital Bangkok have been severely disrupted after being hit by flash floods.
Provisional results suggest Jovenel Moïse has won the presidential election in Haiti.
1.7 million people had posted a hashtag #MeToo message in 85 countries.
Governments must walk the talk of providing quality health care for all, according to the World Health Organization's incoming chief, Dr. Tedros Adhanom Ghebreyesus.
Universal health coverage is more than just health care. It means ensuring people can get quality health services where and when they need them without suffering financial hardship.
So, as you can see, a lot's been happening since 2012. There's been political upheaval, elections, earthquakes, disease outbreaks, new technology, the Sustainable Development Goals, and all of this has had an impact on HFG's work. The demand for HFG has been going up steadily across the 6 years, and we've worked in over 40 countries with 4 regional bureaus of USAID. And with 8 clients here in DC working on HIV/AIDS, TB, maternal child health, malaria, family planning, health systems, and health security. We've had our biggest country programs have been in Ethiopia, Haiti, Nigeria, India, DRC, and Cote d'Ivoire, but with a long tail of smaller programs in many other countries. Of our 4 HFG objectives covering health finance, governance, operations, and measuring performance, most of the activities have been classified as being health finance. But in fact, as you'll see, it's very difficult to classify systems activities into simple categories. A lot of our health financing work has involved interventions involving governance, operational elements, and measuring performance. So what's been the results and achievements of all this effort and investments? HFG has been building sustainable health systems. Sustainable solutions has been our mantra, and I'd like to just focus on 3 countries to show this: Haiti, Cote d'Ivoire, and India. In Haiti, there was significant political upheaval in the country in the first few years of the project, and this has provided some difficulties, but despite that, we've seen some notable successes. HFG has worked on the health workforce national strategy, including working with nursing schools. There's been a rapid expansion of nursing schools in recent years in Haiti, but many of them are producing nurses that simply don't have the right skills to do their job. HFG helped design and put in place the reconnaissance program of accreditation. And since then, 125 nursing schools have been evaluated. 64 of them have received accreditation. Initial results have shown that the student pass rate in national licensing exams has gone up by 9%. This has proved to be so successful, the national government is now thinking about having a similar accreditation program for medical and pharmacy schools. Cote d'Ivoire provides a nice example of what sustainability means in practice. The project activities must be owned and led by counterparts in country. The HFG program has focused on mobilizing domestic resources for HIV/AIDS, empowering community-based nurses to expand access to HIV/AIDS services through task sharing. We've also, post-Ebola, worked with national and subnational authorities on the health security plan. All this work has been done closely with government counterparts, and they own and lead implementation going forward. At the recent End of Project event, the government insisted on leading the agenda, presenting the achievements of the HFG project, the remaining challenges, and the lessons learned along the way. This was music to my ears because not only does it show that the work is perceived to be important, but it's likely to be sustained and built upon going into the future. In India, there is simply not enough investment in health, and many of the states across the country don't have the capabilities to deliver on the health needs of its population. The federal government provides funds to states to try and cover some of their essential health services, but this has a variable effect. HFG has worked with the federal government's, in India, the policy think tank, Niti Aayog, to define a national performance index, a health performance index. This is going to be used by the federal government to start outcome-based financing of its states. Time will tell if this is going to be effective. But it is interesting to see that a complex federal government that is struggling to achieve universal health coverage can actually put in place meaningful reforms. Equity is at the heart of HFG's mission. We have been improving on health inequities and helping provide financial protection to those who are most vulnerable. A couple of countries show this quite nicely. One is Ethiopia, as already mentioned by Kelly, where the government has been expanding essential health services across the country quite rapidly in recent years and has been doing a pretty good job. But many people still face high out-of-pocket payments, risking impoverishment, and some people simply cannot pay at all, meaning that those that most need these services are denied them. HFG has worked with the government to expand the community-based health insurance, or CBHI scheme. This targets the 90% of Ethiopians, mainly rural populations, who are across 900 wardas in Ethiopia. With HFG support, coverage has gone from 700,000 to 17 million beneficiaries. And then the government has provided the subsidy to ensure the very poor also have access to essential services and life-saving interventions. There's been numerous benefits, including empowering women who no longer need to go to their husbands to get permission to access essential health services for themselves and for their children. Vietnam is the second example. There's been a significant concentrated HIV/AIDS epidemic, primarily in people who inject drugs, their sexual partners, and men who have sex with men. A robust response was put in place with PEPFAR support and Global Fund, but with very little domestic resources. This is now having to change as the donors are signaling they'll be withdrawing from the country. HFG, through the Sustainable Financing Initiative, has put in place a set of activities with the central government and the 9 provinces to transition the HIV/AIDS response to one that is operated and funded by Vietnam. The Social Health Insurance Scheme, or SHI, will become the primary financing mechanism for HIV/AIDS services. Donor-funded standalone HIV/AIDS facilities are going to be integrated into facilities that are funded by SHI. People living with HIV/AIDS are being enrolled into the SHI, going from almost 0% coverage to over 85% coverage. The central government will procure antiretroviral drugs for the whole country. So in combination, all these activities mean that HFG will transition its HIV/AIDS response to one that is locally governed and financed. Systems thinking, local systems thinking, is at the core of how HFG does its work. And we've been working with priority programs to look at solving some of their biggest challenges and problems. Our core work has been, a lot of it has been on HIV/AIDS, as you can see, and we've worked in 13 countries where PEPFAR and the Global Fund are active to help mobilize domestic resources for a scaled up and sustained HIV/AIDS response. In maternal, child and newborn health, we've done an analysis around some of the demand and supply side problems, an example being working on the cost of interventions to mitigate the delays in accessing services in Uganda and Zambia, so that we can come up with the real cost of actually saving maternal and newborn lives. On TB, we've worked in 9 priority countries, some of them with significant drug resistance TB problems, looking to see how TB can be integrated into locally sustainable mechanisms with good monitoring of quality. On family planning, we've worked in West Africa. First of all, enabling countries to exchange information about their financing initiatives to move towards universal health coverage, and more recently, looking at the impact of free family planning services in many countries. Global health security has been on the HFG agenda. Following the devastating Ebola outbreak in West Africa, it was clear to see the problems that arise when there's lack of clear leadership and governance of a major disease outbreak. HFG has worked with the government, the Ministry of Health in Guinea, one of the worst affected countries, to strengthen their capacity using the institutional capacity building framework developed by TRG, one of HFG's partners. We've strengthened the capacity of the Ministry of Health, and so they can deliver on its core functions, but also make it more transparent and accountable, so it can build up trust and confidence in the public. Because all of that is important if we're going to have an effective outbreak detection and response. In the Caribbean, we've worked with regional stakeholders to develop a coordinated regional response to the full global health security agenda. Political leaders there are now committed to a comprehensive response involving a network of public health institutions linked to local response mechanisms. In fact, it's provided a nice model of a regional cross-country approach for GHSA that could be applied in other settings. We have had to collaborate to succeed. And whilst this is true for virtually all of our work, there's a few nice examples that stand out. We've worked with USAID to update the health systems assessment approach. This is a nice way of working with national stakeholders to define the priorities for health system strengthening activities. HFG has worked with USAID implementing partners, WHO, and others to pull together an updated approach. The approach is now available as an updated version, and it also has a greater buy-in from many of USAID's global partners. This is, in fact, the 3rd update of HSAA, and this one is now mobile phone enabled to ease reference and use, and in fact it's on display outside for you to play around with it at lunchtime. Fruitful, long-standing collaboration has been on the system of health accounts with WHO, where we work with national stakeholders to help systematically track health expenditures. HFG has worked in 19 countries to build capacity to collect the data, but also to use it. Collaboration is also key to success at the country level. And in fact, it's part of the DNA of how we do our work. One example has been in Nigeria, where we've pulled together partners, national partners and international partners, to support a network of legislators at the federal and state level who want to advocate both internally and externally for universal health coverage. In Indonesia, we've worked with the World Bank and other partners to strengthen the strategic health purchasing function as part of the complex set of reforms rolling out, health financing reforms rolling out in the country. In the area of quality, we've worked with global stakeholders and country stakeholders to examine the different governance options for improving the quality of health services. WHO has now taken over the community of practice that was set up so that country stakeholders can continue to exchange their experiences. Our last activity in this area will be working with the Ghanaian government to look at the institutional options for governing quality and quality improvement in the country. HFG has been involved in generating and synthesizing a phenomenal amount of health systems strengthening knowledge. Some of this has recently been published in the HFG special series on health systems reform in the Harvard's Journal, and that's available in hard copies outside for those of you who still like hard copies. HFG also worked with USAID, as we heard from Kelly, on their report on impact of health system strengthening on health. This carefully summarized the compelling evidence that we now have that health, on the interventions and approaches to strengthen health systems and deliver health outcomes in low, middle income country settings. Since its launch in 2015, it has been the most commonly accessed resource on the HFG website, with over 9,000 downloads by individuals all around the world. To me, reading the report, it shows the importance of understanding the key actors in countries and the systems they need to have an impact. And we have to know that if we are going to deliver on our global priority goals, such as ending preventable maternal and child deaths, creating an 80 generation, and protecting communities against infectious diseases like TB and neglected tropical diseases. One area there was a gap, health governance, and there's a gap in our global knowledge. So as we heard from Kelly, HFG worked under USAID's leadership, again collaborating with implementing partners, WHO, the bank, and others, to try and fill this gap in our global knowledge. 4 technical working groups were set up to amass the evidence and prepare reports that linked governance to health outcomes in 4 areas: public financial management, policy and regulation, the use of knowledge for health policy, and accountability. That work has now been shared and disseminated through WHO, through civil society networks, and it's part of the growing momentum on the need to build effective governance into our approaches for scaling up essential health services and moving towards universal health coverage. Another mechanism that HFG has been used is peer learning between country practitioners through the Joint Learning Network managed by R4D. HFG is involved in the JLN in many areas. A recent example was working with 9 countries to exchange on the how-tos for strategic communications to improve advocacy for universal health coverage. We also work with the Asia Bureau with JLN using their private sector engagement collaborative to document the lessons around stewardship of the private sector. We've also worked with the Asia and Africa bureaus for peer learning through the Health System Strengthening Flagship course involving bringing in experts from Harvard, WHO, the World Bank, and others. The HFG has had a knowledge and learning strategy in place for the last 2 years of the project under the leadership of Sarah Bennett from Johns Hopkins. The strategy focused on the areas where HFG is most in demand. And it's built up a series of webinars, podcasts, and technical exchanges in the last year of the project. The Advances series will continue to the end of the project, documenting lessons, coming up with briefs and technical exchanges up until September when we finish. The full Advances series is available outside for you to look at, together with other HFG highlights, such as the upcoming Technical Efficiency Guide, which I'm very excited to see out there, but also some of our country reports that include modelling estimates of HFG's impact in countries done by Avenir in a very robust way. We also have with us today, as you heard from Jay, some of our chiefs of party from many of the countries, in case you want to have country-specific deep dive discussions, and details are in your programme. So I'd like to close by just saying thank you to our AOR team, Scott Stewart, Jodie Charles, and Bob Emery for all their guidance and support. I'd like to thank you all for being here today so that we can continue to collectively gain and grow our knowledge on health system strengthening. On behalf of HFG I'd like to say, please enjoy the day. Thank you.